All right, so hello and welcome everyone. This is your 2020 benefits enrollment meeting. Open enrollment window will be open from February 10th through February 21st this year. My name is Janelle. As Donna said, I'm with Cuba and I'll be your presenter today. So again, we'd like to just welcome you and thank you for being one of ICUBA's 27 members. We're very excited to be going into our 18th year of service to Florida private education employees. Here is just a sneak peek of what we will be reviewing today. On the right-hand side, on the left-hand side, what's new for April 2020. There's a low increase on the medical premiums. We'll also discuss some Rally program enhancements. We'll touch on dependent verification and how you can enter or confirm your phone number and email address for a prize drawing from ICUBA. On the right-hand side, we will also be going over the same great benefits that are in place now. Nothing as far as the core of those benefits will be changing, so most of that will just be a review. So ICUBA is a self-funded medical plan, and that means that we pay all claims processed by our medical, pharmacy, and behavioral health benefit managers from the premiums that we collect from you all and the reserves that we built up over the years. ICUBA keeps all premium dollars saved for the exclusive benefit of you, our members. We spend premium dollars only on your benefits. These plans, another thing, these plans are specifically designed by educators for educators. We have a committee that meets once a month to discuss these things. And then lastly, ICUBA's main goal is try to invest in a long-term culture of well-being so that you all can be the best versions of yourselves. And so thanks to all of your hard work and effort, we are pleased to bring you the lower medical premium increase for this upcoming 2020-2021 plan year. We'll first start out with the Rally program enhancements. So first we'll touch on the survey. The survey is going to be the gatekeeper again this year. So when you log into Rally, you want to make sure you complete that survey or else you will not be able to see and access any of your Rally dollars. Some of the enhancements this year will come into play under wellness, the biometric screening, and then some on-site and campus events. The wellness exam has increased from $25 to $60 this next year. Biometric screenings as well will increase to $40, that's up from $25. And then for your on-campus, on-site and campus events, last year you were only able to earn $50. This year, we've increased that by 2 events, so you're able to earn up to $70. For your preventative exams, your PSAs, colonoscopies, and mammograms, it's still $50 for the first claim process. You still have an opportunity to earn $50 for an Cuba Cares qualified medication change. And then for our city missions, city challenges and missions, those you still can earn unlimited coins. We also do a private ICUBA Sweepstakes for those. For TellaDoc registration and registering for the tobacco attestation program, you can earn 400 Rally coins. And then for the clinical rewards program, it's still 500 coins per quarter, up to 2,000 coins. We did want to include just a fun, feel-good fact. ICUBA members donated more than 4 million coins to various Rally charities last year. So kudos to everyone who donated. And then just one other thing about the coins. I know we hear that coins aren't worth a lot, but Rally does have some flash sales. Usually about once a month, you'll get an email regarding a flash sale where you can get some really good discounts on things like movie tickets, theme park tickets, smart devices such as your Fitbit watch. So if you have some coins and you're looking for a way to use them, think of maybe donating them or using them during one of those Rally flash sales. Next, we're also introducing the physician results form. So there's no more finger pricks or additional blood draws starting April 1st. You can log on to the MyQuest for Health portal. If you've ever did the patient service center appointment, it's that same website. You'll register there at Quest to create your username and password. From there, you'll be able to download this physician results form and we have a sample here in the lower right-hand corner of the screen. You will schedule your appointment in step 3. You'll schedule your appointment with your primary care physician. Be sure to take this form with you. If your doctor does a blood draw right in their office, there's nothing else for you to do. Your doctor will get your results back from Quest. He'll fill out this form and send it on over. We do just want to suggest that you don't make copies of this form and pass them out to your friends there on campus, because this form will be specific to you. And then also, we think it's a good idea, once you've completed that information and your doctor has your blood work, try to get a copy of that signed form for your records. We do realize that the front office staff there at the doctor's office can get busy, and you just don't want to leave it in their hands. Get a copy for yourself. If it's taking too long, then you can either upload it to your portal or fax it to Quest yourself. A couple of rally reminders. One is the Clinical Rewards for Chronic Conditions program. So the Clinical Reward program will provide those who have any of these chronic conditions outlined here on the screen with just some extra help by way of coaching and educational materials. For those of you who qualify, who have been diagnosed with one of these conditions, when you log into the Rally portal, you will see some information there for you to do. There's some materials, as I mentioned earlier, that you can browse through. You'll also be able to connect with that coach for the Clinical Rewards program. By participating and reaching your goals, you could earn 500 coins per quarter for a total of $2,000 per year. And then on the right-hand side, we're still doing our city challenges and private sweepstakes. So they have some city challenges within the Rally portal. You will just sync your smart device, your Fitbit or your smartwatch or your phone, and then you'll join one of these city challenges. Each time you reach a milestone, you're automatically entered into our drawing. We're not asking that you win, only that you participate. And IQUBA does a drawing every 2 weeks, and we're giving out $50 Amazon gift cards. Next, we just wanted to show you kind of the value of the improvements that we're making with the Rally program. If you've ever been through an enrollment, you're pretty familiar with Emma. Her picture's there on the right-hand side of the screen. And so using Emma as an example, we hope that by this time next year, this will be Emma's story. So she's downloaded the Blue Cross and Blue Shield mobile app, where she was able to locate a Blue Distinction Total Care provider. She got an annual physical at her doctor's office for free because he's a BDTC. And just for doing her physical, she's earned 60 Rally dollars. Her primary care physician submitted that Quest physician results form, earning her an additional $40 for her biometrics. So all she's done is go for her annual screening, and Emma's already earned $100. At work, Emma participated in 5 on-site events totaling $50, and she's hoping to squeeze in 2 more. During a recent doctor's visit, Emma was diagnosed as a diabetic, so she connected with a Blue Cross and Blue Shield health coach through the Rally's Clinical Reward program to help her control that condition. To date, she's earned, and this time next year, she's earned $150, and she's donated 8,000 coins to various Rally charities. So Emma hasn't done much. She's went to the doctor's office, and she's already on campus, and she participated in some events. So she hasn't really had to go out of her way or do any, been through any extenuating circumstances to get that $150. And then if she qualifies for a mammogram or a PSA or colonoscopy, or if she qualifies for a medication change, she has the ability to earn much, much more. So we just wanted to show you guys just how easy it is to participate and earn those Rally dollars coming up for this next plan year. Next, we'll touch on dependent verification. So dependents that are not eligible under the plan should be removed right now during open enrollment. If you do have an ineligible dependent and you have to remove them, coverage will terminate on March 31st of 2020. We won't automatically drop them from the plan. And so we just wanted to let you know that as you're going through your enrollment instance, there will be this paragraph here in the blue writing in which you are certifying that everyone that you chose to elect coverage for is eligible for the IQUBA plan. And so who is an eligible dependent? It's your legally recognized spouse, your natural child, your legally adopted child, your stepchild, a child required to be covered pursuant to a qualified medical support order, a child for whom you have proof of legal guardianship who resides with you, and a foster child. We also wanted to remind you that a child is dependent until the end of the calendar year in which they attain 26. If you have a disabled child, that's a child who's over the age of 26 and continuously incapable of self-care. They can remain on the plan after the age of 26. However, you will need to provide your employer with proof of disability before that coverage can continue. Next, we just wanted to touch on how you enroll in your benefits. You'll start by going to the ICUBA portal at icubabenefits.org. Right now, during open enrollment, you're free to make any changes that you see fit. Your elections will have to remain in effect for this full plan year as stipulated by IRS Section 125 rule. You can make some changes during the year, but only if you experience a qualified life event. So how do you get started? Again, you go to the ICUBA portal, you log in. On your home page, you'll see a little button drop down that says Start Your Enrollment. So you'll click on that. We included a little legend here in that gray box to the left-hand side. As you go through, you'll update your information, your family information. You'll choose your benefits. You'll confirm your enrollment, and then your enrollment is complete. Once you complete your enrollment, we do highly suggest that you email a copy of that confirmation statement to yourself, just so you will have confirmation that you completed your enrollment and you'll have confirmation of the plans you chose. Emma is also available as your decision support tool again this year. Most will disable Emma at the beginning. Just keep in mind that she is able to help you at any time in your enrollment. She'll be located in the top left-hand corner of your screen. We do have another open enrollment sweepstakes going on this year. When you're going through your enrollment, you'll be asked to update and or confirm your personal phone number and your personal email address. There's a little box where you'll check, I agree that my information is accurate as is accurate to the best of your ability. You'll finalize your enrollment and then you're automatically entered. I do just want to suggest that you verify that your information is there. We had someone last year that said, yes, I agree, but they neglected to put any information in, so we had to choose another winner. So just make sure that that information is there if you want to be entered into the sweepstakes. Improving access to care by eliminating barriers. So we at ICUBA think it's very important for you to be an educated healthcare consumer and understand how your plan pays, what coverage you have before you get to your doctor's office. So we've come up with the medical, prescription, behavioral health plans. They're specifically designed to remove barriers for you all. So we made them where the deductible only applies to those major services. So coming up here, we'll discuss how we've created some things to try to break down those barriers to care. First way we've done that is by single sign-on via the ICUBA Benefits Portal. So when you log into the ICUBA portal, on the home screen, there's a section called My Carrier Accounts. This section will give you links to all of our brand partner portals. When you click on the link for the first time, you may be asked to create a username and password, but going forward, anytime you visit the site and click on one of these links, you'll be directly logged into your personal portal at Blue Cross, Optum, Aetna, IMed, so you don't have to log in each time. If you can't remember your password, just come to ICUBA, click on that link, and then you're off to find whatever information you need. Next, we just wanted to highlight and just inform you of those benefits that are at no cost to you, those that may apply to the deductible, and then those benefits that are not subject to the deductible. We'll start on the far left-hand column, no cost to access, and I won't name them all, but just a few, your Blue Distinct Total Care visits, if you need immunizations, colonoscopies, all of our EAP services, mammograms, and then Surgery Plus for those non-emergent surgeries. Those, among many other benefits, are at no cost to you. that middle section, there's no deductible for advanced imaging, your chiropractic services, emergency room, emergency transportation, your maternity visits, prescription drugs, if you need maybe occupational, physical, or speech therapy, or you need to go to urgent care, those things are not subject to the deductible. You may have a copay or a co-insurance, but the deductible does not apply to those benefits. And then on the far right-hand corner, the deductible does apply to major services like durable medical equipment, hearing aids, your hospital expenses, inpatient mental health or substance abuse, private nursing duty, any prosthetics that you may need, ultrasounds, except of the breast, those are covered at 100%, and x-rays. Those are considered major services, so the deductible would apply to those. And then one other thing on the x-ray, if you are doing the x-ray in your primary care physician's office or in a specialist office, then that is not subject to the deductible. That would just fall under your co-insurance or copay. But if you're getting it done in an independent lab or at a hospital, then that x-ray will apply to your deductible. Next, we'll review the Surgery Plus benefit. This is paired with your medical plan. So if you elected medical, you don't have to make a separate election for this. So with Surgery Plus, you have access to the Elite Surgery Plus Surgeons of Excellence Network. The surgeons are licensed, board certified, fellowship trained. They've been screened for malpractice, sanctions, and criminal records. We wanted to put a few of the more common covered procedures here, but this list is not all inclusive. There are many more covered procedures available to you. You can access this through the Surgery Plus single sign-on from the iCuba portal. And so what's the advantage of going through Surgery Plus versus the traditional Blue Cross and Blue Shield medical insurance? Well, for you, your deductible and co-insurance are waived. So this procedure is being done at no cost to you. There's also a travel benefit included. It's a very new benefit. So we may have the doctors, but we may not have the facilities in your area, so you may need to travel. There's a separate benefit for flight or car travel. It covers gas and food, a food allowance as well. You do get the benefit if you need a spouse or a buddy or someone to come with you. You get extra amount for that person to come with you as well. And so they also offer a full concierge service. So you'll give them a call if you're told you have a non-emergent medically necessary surgery. They'll give you a list of providers to choose from. They can help you coordinate with that provider, schedule your appointments, transfer all of your medical records. They can even help schedule your follow-up appointments if necessary. So if you're in the market for a surgery, or maybe you've been putting a surgery off because you could not afford it, Surgery Plus is a great option for you to consider. And this is currently in effect right now for anyone who's currently covered under the medical plan. Next, we'll review TellaDoc. We just want to remind you that this is available and you can access it via the iCuba portal as well. You'll click on that Blue Cross and Blue Shield link, and there will be a link in Blue Cross that will send you right into TellaDoc. It's only a $5 copay. And so why would you use TellaDoc? We really designed it to be an alternative to the emergency room or urgent care for those who maybe just don't have the time. You're in school and you're at work, or you're on vacation or a business trip. Consider TellaDoc. You can do a consultation with a licensed physician over the phone or via a video consultation. When you register, your company key will be iCuba. But once you're registered, you can choose a physician. They'll usually give you a call back within a minute or so and start that visit. We put some top diagnoses of why people are contacting TellaDoc here on the screen: sinus problems, pink eye, upper respiratory infections, you have allergies. Maybe you are on vacation and you've forgotten the medication. They can write prescriptions as needed. We did want to just mention that they do not prescribe controlled substances, psychiatric medications, or any lifestyle drugs. So for those of you who need that type of medication, you do want to continue that relationship with their primary care physician. But we just want to remind you that TellaDoc is out there, and it is only a $5 copay. Next is the Cuba Cares Pharmacist Advocate Program. Do you have side effects to a new medication? Or maybe you've been denied at the pharmacy. They told you you had a prior authorization and you've misplaced that letter from Optum. Or you were denied a medication. They told you you need to do step therapy, which means you need to try another lower cost drug before you can take a certain drug. Or you just want to learn how you can save money by switching to a generic. These are all great reasons to call Cuba Cares. Their numbers here on the screen. It's also on the back of your Optum RX prescription insurance card. They're available Monday through Friday from 9 a.m. to 5 p.m. Each person, staff there at Cuba Cares, they're real pharmacists. They will really advocate for you, the employee, and try to offer you real solutions. So if you have a medication and right now you have a $75 copay and you're wondering if there's a coupon or any lower price out there, something that can help, give Cuba Cares a call. They're always willing to help and step in the middle of you and Optum and the pharmacy and just try to get a resolution for you. We also want to remind you that Aetna still does have the Able To program available to all our members enrolled in the medical plan free. So if you or any of your covered members have any of these health and life conditions outlined here on the screen, you can enroll in this Able To program. You can meet with a licensed therapist and a behavioral coach. You'll meet once a week. There's 16 free sessions. These are no cost to you. They can just help you address some of those behavioral problems that come along with your health issues. They can help you set health goals, develop an action plan. I myself personally went through the Able To program for chronic pain, and I can say with 100% honesty that a year and a half later, I am still benefiting from the things that I learned from this program. I know a lot of people haven't taken to it. I don't know why. I personally think this was just like a great, great program for me. Health management and care consultants are also available to you. These are trained healthcare advisors and registered nurses who've been trained to provide you with tools, education, and advocacy to help manage your chronic health conditions. They can help you set goals, help you understand the treatment plan your doctor set for you. They can help you with referrals or transition to care, or if you have any gaps in your care, they can identify that and help you address those things. So if you get a call from Blue Cross and Blue Shield, Optum, Cuba Cares, or Aetna, they're calling because they care and they really want to help you address any type of health issues that you may have. I know some are leery that these calls may be someone trying to scam you, but I would just suggest giving them 5 minutes of your time. If you're not interested, you can always tell them so, but just hear them out, give them 5 minutes. We found that most people who engage typically see a significant cost in the amount that they're spending on all of those health issues. Next, we wanted to remind you of the free Blue Distinct Total Care Visit. So if you have a primary care doctor who's in family practice, internal medicine, or a pediatrician who has that Blue Distinct Total Care designation, your visits, whether they're well or sick visits, are always at zero cost to you. We also wanted to remind you that for the second year, beginning April, we'll have access to that Blue Cross and Blue Shield Care Connected customer service team. So this is a dedicated team who's been specifically trained on Cuba benefits. They can help answer claim questions. If they find an error on the claim, they can reprocess it right there on the spot for you. They can help you with any other billing issues you may be having with your provider. They can get in contact with the provider for you. They can assist you in finding a Blue Distinct Total Care doctor. They can put you in contact with lifestyle coaches and chronic condition coaches. There's no new number to remember. It's the same customer service number that's on the back of your current Blue Cross and Blue Shield ID card. So if you're experiencing any kind of issues or you have questions with medical, try contacting that Care Connected team. They're there to assist us, and they're there specifically for Cuba members. Next is the Blue Cross and Blue Shield My Health Toolkit mobile app. It was they revamped the platform last year, so we just want to remind you that it's out there. Some of the great features of the app is the first picture, and the one I like the most. Once you've logged in, You can save your ID card to your home screen. So if you're at your doctor's office and you don't have your ID card, you don't need to log into the app. You can just push View ID Card. It'll automatically pop up there for you. If you have a spouse or maybe children covered and they're at the doctor and they've forgotten their card, you can actually send them a text message with their card in it. It does have as well the Touch ID and facial recognition capabilities, and it's real-time data. So if you're in a doctor's office and they say, well, that last visit, you owe us $150 and you don't agree, you can go to this app, pull up that claim, and show them the amount that insurance says that you owe. And so you can find your ID cards, claims, you can get a description of all your benefits and much, much more from this app. This app is also now integrated with Rally, so you can access the Rally portal directly from this app as well. Next, we wanted to review the EAP program that's available to all active employees through Aetna Resources for Living. So you do not need to be enrolled in the medical plan to access these EAP benefits. They can assist you with emotional, life, legal, financial issues. On the emotional side, you're able to speak with a licensed clinician. You can do 6 sessions per year per issue for each member of your household. So if you're having an issue with your child's behavior at school, you get 6 free sessions, that's an issue. And then that same child, you're having issues with their behavior at home, that's another issue. So that's another 6 free sessions for you. Under the life side of things, they can help you with tons of referrals if you need a gardener or a daycare provider, or they have entertainment, travel, fitness discounts. I get my LA Fitness monthly fitness discount on that. They also have some legal templates, tons of templates if you need like a will, or you're maybe a landlord and you have you need some type of tenant agreement. They have tons of templates out there, and they can help you with many other legal issues. They can put you in touch with a lawyer at a discounted rate if you're looking for one. And then you can also get consultation on financial needs. They can help with budgeting, retirement planning, college planning. It's tax time right now, so they can also assist you with tax issues. If you're having a question, don't pay extra to tap into that HR block premium. You can contact one of these financial advisors there at Aetna Resources for Living. The numbers here on the screen, again, it's available to all active employees. And the good thing about it is that all of the calls there are free and they're confidential. Next, EAP has gone digital with Talk Space. So for those of you who maybe don't like to talk on your phone all the time, you can send unlimited text, audio, pictures, and video to a licensed therapist. On average, 1 week of Talk Space messaging equals 1 EAP session. So you do need to give Resources for Living a call to get authorization. Once they've authorized you, you can register. They'll give you an option between, I think, maybe 3 therapists. You choose your therapist and begin communication. This program is only available to adults who are over the age of 18. So if you have a child who may be interested, unfortunately, they won't be able to participate in Talkspace. You'll have to go some of the more traditional routes through EAP or the behavioral health program for your children. We also wanted to remind you that another way we try to break down barriers is through mobile apps, not just from the Blue Cross and Blue Shield side of things, but from many of our other carriers as well. Many of these apps are able to do the same thing the Blue Cross and Blue Shield app is. They can give you your card. You can also request replacement cards and much, much more directly from these apps. Rachel gave me a great idea of downloading them all and putting them into an iCuba folder on my phone. So I like that idea. I started that a few weeks ago and it's been great. But just keep in mind that for you all who are enrolled in any of these benefits, these mobile apps are available to you. And then great news, the same benefits will remain in place for the brand partners on the existing plans. So for these brand partners listed here, your benefits are going to be remaining the same. So a lot of what this next section contains will be a review for most employees sitting here. First is the medical plan. We just wanted to highlight the 2 plans that are available. And this slide is for in-network benefits only. The blue section, your deductible, co-insurance, and your out-of-pocket maximum is going to be the same for both plans. In that middle white section here, where you see your physician's visit specialist, urgent care, outpatient emergency room, everything in white is how these two plans differ. The coverage on these plans are going to be exactly the same. The difference comes in how you as a member would like to pay for your visits. Are you more comfortable with a co-insurance? Then the preferred PPO plan is the plan for you. Are you someone who likes maybe a copay? You like to budget and you like to know how much you're going to be responsible for up front? Then you may want to consider that Premier copay. But keep in mind, if you don't care either way, the Premier plan will be the most cost-effective option for you. And then towards the bottom of the screen, that gray section, the benefits are going to be, again, the same no matter what plan you choose. Your Blue Distinct Total Care, TellaDoc, your convenient care clinics, preventative care visits, outpatient diagnostic imaging, and your ambulance rides are all paid at the same amounts that are listed here on the screen. Next is the prescription drug plan through Optum. Again, none of these benefits are changing for the upcoming plan year. We'll still have the same tiers and the same copay structure. We did just want to highlight the 90-day fill at retail or mail will save you money. You'll get 3 months worth of prescriptions for the cost of 2 by doing it 90-day versus 30-day. We also wanted to point your attention to some of the prescription drug freebies that are available to you. Your diabetic supplies, prescribed aspirin for adults, prescribed generic folic acid, generic prenatal vitamins for pregnancy, and if you qualify, prescribed generic statins are all free under the plan. And then we also just wanted to make note that there is a separate prescription drug out-of-pocket maximum. If you're someone who maybe has a lot of prescriptions, but you're not going to the doctor that often, we did put a separate out-of-pocket max on the prescription plan to give you some type of income protection. Next is the Aetna Behavioral Health and Substance Abuse Plan. So you do have to be enrolled in medical for behavioral health and substance abuse. They can provide you with professional counseling to a licensed clinician. And again, you can do in-office, telephone, or video. They can help manage psychiatric medication evaluation. If you think maybe you or one of your family members is in need, they can help you with that. They also have some autism benefits for those applied behavioral analysis therapy for those on the autism spectrum. Those benefits will be under Aetna. And then if you need hospitalization, detoxification, or residential treatment, there's benefits there available for that as well. Just keep in mind that for your autism and those intensive services, prior authorization is required. But otherwise, again, it's the same number for EAP as well as behavioral health. So if you're someone that only needs EAP, you'll do option 1. Behavioral health will be option 2. Next are the IMed vision plans. Again, I know it sounds like a broken record, but nothing is changing here for the upcoming plan year. You have the base and the buy-up plans available. I'll just touch on some of the differences of these two plans. First, it's the frames. Under the base plan, you're allowed to get frames once every 2 years. On the buy-up plan, you're allowed frames once every year. And then the other difference comes in on your frames allowance and your contact allowance. Under the base plan, your allowance is $100 for frames, $100 for contacts, and then anything above that, you receive a discount. And then under the buy-up plan, that allowance is $130. So that's the IMed plans. And again, nothing else will be changing for these plans for the upcoming plan year. Next is your Guardian Dental plans. You'll still have the 2 PPO plans. There's option 1 and option 2 available again this year. We've highlighted here some of the major differences: preventative, basic, major care. On the option 1, in-network, preventative care is covered at 100%, basic care at 80%, and major care is covered at 50%. Option 2, preventative care is covered at 100%, basic care covered at 100%, and that major care is covered at 60% on your Guardian dental plan. We also wanted to finally discuss some open enrollment housekeeping with you. Just again, we want to remind you that any changes you make for open enrollment, you have to keep. These elections are irrevocable unless you experience a qualified life event. That's a birth, adoption, death, divorce, you gain or lose coverage. Then you're able to make changes to your benefits mid-year. You only have 30 days from the date of birth, the date of death, the date of divorce, the date you gain other coverage to make these changes to your benefits. The 1095 tax form is available on the IQuba Benefits Portal in your employee file. You can get there by logging in, going to My Profile, and then Employee File. Again, these forms are not required again to file your taxes. If you need it, it's there. But if not, we have all of your 1095 stored there on the IQuba portal. And then finally, we just wanted to highlight that all the requirements of healthcare reform are in place here at IQuba. In fact, our preventative wellness benefits are even more generous than the law requires. So we just want to know that you are in the right plan. There won't be any penalties if you're enrolled in one of our plans. And lastly, I just wanted to thank you all for listening and for your attention today. As I said at the beginning, we're very excited to be starting our 18th year of service to our 27 member schools, including Corbett. And so, Donna, I think if there's nothing else, I can open the floor up for any questions that anyone may have.
Questions? Anybody?